Hey everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Melissa and I'm a nursing student. So before I get started with today's video, I do want to take a quick second just to say that I wish everybody a very Merry Christmas and a very happy holiday season. I'm actually filming this video on Christmas Eve, although I'm not sure when I'm going to be posting this video. But either way, whether you celebrate Christmas or you don't celebrate Christmas, I hope that you are having a very peaceful and loving end to your year and that you are surrounded by loved ones. Now to get into the actual content of today's video. If you have not seen my previous videos, then you may or may not know that I attend Chamberlain University's BSN program. It is an accelerated BSN program, so that means that instead of traditional 16-week semesters, my courses are condensed into 8-week sessions. And so at the end of each session, I upload a video talking about the course or the courses that I took in the last session. So this video is going to be talking about the course that I took in the November-December session, which was Complex Adult Health, or NR 341. That's the course number for those of you all that attend Chamberlain. Now, usually I film these videos prematurely, so before the class actually ends, but for this video, I am filming it a few days after my session ended, so I do know what my final grade was. I ended up finishing the class with a B, which I am very happy about. I don't need to get straight A's in nursing school as long as my GPA stays relatively decent, so this was not an easy class, and I'm very, very happy with the B that I got. So first I'm going to get into exactly what complex health is because I was not fully sure before I entered the class. I heard that it was like a med-surg part 2, which it kind of is, and I also heard that it was basically like a class on the ICU, which it also kind of is. But complex adult health is you learning how to care for patients that are dealing with multiple chronic physical and mental, sometimes behavioral conditions. So pretty much before this class, we have been learning how to take care of patients with congestive heart failure. We have been learning how to take care of patients with diabetes, and maybe they are in DKA, diabetic ketoacidosis. This is the first class really where we are focusing on dealing with a patient that has multiple chronic issues going on at once. So in this class, when you are doing a case study on a patient or you are learning about a patient, the patient may have CHF and diabetes, and they are in diabetic ketoacidosis. You know, the patient has multiple things going on instead of just one thing going on, which is not just in the ICU. Even when I'm in clinicals in med-surg, most of my patients are not just going to have one issue. They're going to have a history of hypertension and diabetes. You know, it's very rare that you're going to have a patient that is completely healthy and then they just have one really bad chronic ailment. So this course really does teach you how to care for patients with multiple things going on. And more importantly, it teaches you how to prioritize care for a patient that has multiple things going on. So if you have a patient whose blood pressure is critically low, their respirations are critically low, they are having issues with their circulatory system, the cardiac system, there's just a number of things going on. This class teaches you to look at what is most critical, what needs to be addressed first, and what interventions need to be put in place first to stabilize the patient. Okay, so now that I've talked about exactly what complex health is, now I'm actually going to get into the layout of the course and what the course entailed. Sorry if you hear background noise, my rabbit is making noise in the background. I have a pet bunny and he's eating very, very loudly. So I will start off by saying, in terms of the layout of this class, the layout of this class was different than any other course that I've taken at Chamberlain so far. So first I'm going to get into the exams in this class. In every other class I've taken, we have only had 3 exams. It's funny because the first day of class, when I entered class, my professor, who I loved, he was so excited. He was like, oh, you only have 2 exams in this class opposed to 3. That's actually not true completely. So this class actually had a total of 6 exams, which my professor was right because only 2 out of the 6 exams were actually on complex health. So I'm gonna get into that. So the first exam that we took was on night 1. Just like any other nursing class at Chamberlain, we had to take our medical calculation exam. For those of you guys that don't know, at every class, every nursing class in Chamberlain, we have to take a medical calculation exam the first night, and we have to pass the med calc exam in order to advance in the class. If you don't pass the exam on the first try, you have to do a mandatory remediation. That may be coming in during your professor's office hours to go over different practice problems, or getting a video that you have to watch and get a certificate for. Either way, you have to do a mandatory remediation, and then you have to sit for the exam a second time. And if you don't pass it the second time, I do believe you have a third chance to take it. If you do not pass it the third time, then you are dropped from the course. And you do have to pass the med calc exam before you can administer medications in the hospital for clinical. So I believe you have to pass your med calc exam. Doesn't matter how many tries, whether it's the first try or the second try, but you have to get a passing score by the end of, I think, either the first or second week, or else you will also be dropped in the course. Now, although every class has a med calc exam, the score that you need to get in order to pass varies depending on the class. In some of the lower level nursing classes, you may only need like a 16 out of 20 points in order to pass the med calc exam. And then the farther that you get into the program, the higher of a percentage you need in order to pass. In complex adult health, you need at least a 19 out of 20 on the med calc exam to pass the exam. Okay, so now the second exam that we took in this class was actually on pharmacology, and it was called our Pharmacology Open Check exam. This exam was administered the first week of classes, and we actually took it at home. The interesting thing about this exam, it was a standardized exam, by the way, so all Chamberlain students took this exam. But the interesting thing about this exam was that the score that we got on the exam did not go into the grade book. This was actually not a graded assignment. However, the score that we got did determine how much of a relearning assignment we would have to do. And I will get into that more once I go into the assignments of this class. But for right now, I'm just talking about the exams. Now, the third exam that we took in this class was also on pharmacology, and this was called our CJE, which stands for Clinical Judgment Exam. So the questions were NCLEX style questions, and they are based on our clinical judgment. This exam was a standardized exam, but it was administered in the classroom. My professor proctored the exam, so he watched us all while we took it, and the score that we got on this exam did go into the grade book. The score that we got on this exam also determined how much of a relearning assignment that we would have to do later. So finally, in week 4, we had our exam 1. I'm putting air quotes in exam 1 because it was called exam 1, which is ironic because it was actually the 4th exam that we took for this class. But the reason why it was called exam 1 was because this was the first exam that was given to us that was actually on complex health. So anything that we learned about complex health from the first day of class up until exam 1 was covered on the first exam. And since it was administered in week 4, it really did serve as a midterm for us. So in week 6, we were given our 5th exam. This was another open check exam, so another standardized exam that we did at home, where our score was not entered into the grade book. But again, the score that we got on this exam did determine how much of a relearning assignment that we would have to do. And this open check was not on pharmacology. This open check actually was on adult health. So it was everything that we were learning in class. And then in week 7, we had our 6th and final exam. This was our complex adult health final. So anything that we learned from day 1 of the class was fair game to go into this final exam. However, I believe the final exam's focus really was everything that we learned from the first exam. So anything from week 4 and beyond, although as you get farther into your nursing classes, you'll learn, since each week kind of builds off the other, even if a professor says that the exam is summative and not cumulative, meaning that you're only going to be tested on things that you learned since the last exam, pretty much anything that you learned from the first day of the class kind of is fair game to be on the final. Now I'm going to talk about the quizzes in this course. The quizzes in this course were also a different layout than any other class that I've had in the past. For one thing, this class only had 4 quizzes, whereas I'm pretty sure every other nursing class I've had in the past has had 5. And our first quiz was not administered until week 6 of the class, which was interesting, but I actually liked it this way because it allowed us to really focus on our assignments and our exams the first half of the class. So quiz 1 was administered in week 6, and then we were given a quiz every week until the course ended, with 2 quizzes being administered in week 8. And each quiz was worth 20 points. I believe in all nursing classes at Chamberlain, all of the quizzes are each worth 20 points. And quiz 4, the final quiz, was administered on the very last day of class. So it was really interesting because our final exam was administered in week 7, even though it's an 8-week class. So in week 8, we had already taken our final exam and all we had were assignments and quizzes to do. Now when it comes to assignments, of course we had our EDAPs that we had to do. For those of you guys that don't know what EDAPT is, because I realize more often than not I just throw it out there that we have EDAPs to do. EDAPT is spelled E-D-A-P-T, and it is an online software, like a learning tool, that the best way that I can describe it is it's kind of like a PowerPoint slide where you have slides of information on the material that you're learning in class, and it's kind of like summarizes things for you and teaches you. And then on later slides you are quizzed and collect style questions based on the previous slides that you just read, and then the score that you get on those questions goes into the grade book. It's a homework assignment. My rabbit is drinking water. Do you guys want to see him? I don't think I've ever shown you guys my rabbit. There he is making noise, drinking water. His name is Smudge, and I've had him for about 7 years now, in case anybody cares. He's adorable. He's like the sweetest animal. But he drinks water very, very loudly. Okay, so Smudge finally finished drinking his water. Now he's rearranging his bedding in his cage. So hopefully he's not making too much noise. I'm just gonna keep going. I think I was talking about the EDAPT assignments. I don't remember what I was saying, but I'll just finish off by saying that, in my opinion, from what I remember, this was a very EDAPT heavy class. And when I say that, I mean that we had a lot of EDAPTs to do. We have EDAPT assignments that we have to do every week. And that's pretty much how it is in every class at Chamberlain, every nursing class at Chamberlain. But some classes have significantly more EDAPT assignments than others. And from what I remember, especially towards the beginning of the class, this had a lot of EDAPTs. In addition to the EDAPT assignments, we also had our RUA, which is an acronym for Required Uniform Assignment. In every class, and I think with every professor, this could be different. Sometimes it is a final project, like a group project that you have to do and present in front of the class. Sometimes it is a group project that you don't have to present in front of the class, but maybe it's like a PowerPoint or a pamphlet or something that you have to make and show to your professor. Other times it is a research paper. I don't know if it was just my professor or my campus, but either way, for me, the RUA had to do with complex health. I'm not going to tell you guys what the topic of the paper was because I don't want to be a cheater, but it was a paper that we had to do, a research paper. And I believe that we had the option of doing it as a pair or doing it individually. I don't remember. I think that was an option he gave us, but I just chose to do it individually. I think pretty much everyone in the class chose to do it individually, if I'm remembering correctly. And so the way that my professor did it was that he gave us a list of topics that we could choose from. And I think you had the option. You can choose from one of his pre-approved topics, or you could select your own topic, but you would just have to get his approval beforehand. So I just went the easy route and I picked one of his pre-approved topics. I did my research, I wrote my paper, and I am good at writing. I like to get 100% on all my papers, but for whatever reason I got a 96 on this one, which I'm not complaining, it's still an A. So I did well on the paper. I didn't think it was too difficult. And so in addition to the EDAPs and the RUA, we also had the relearning assignments. So remember when I was talking about the exams and I was saying, depending on how well we did on the exams, we had relearning assignments. I am now going to get into the relearning assignments. So for every single exam in this course, except for the MedCalc exam, which was the first exam that we took, we got a diagnostic report through a software called ExamSoft. So after we completed each exam, we were essentially given like a very detailed report that showed not only our score on the exam, but it broke down the exam into different categories based on topics of the exam. So there may be a category on like glucose regulation, another category on the respiratory system, another category on like clinical judgment. And so this software, Exemplify, it gives you a report to not only show you your overall percentage and your overall grade, but it will actually grade you on each topic that was covered on the exam. And so for the relearning activity, what we had to do for every exam was look at our overall score, look at the like diagnostic report that Exemplify did for us, and we had to select multiple areas on each exam that we scored low on or that were labeled as needs improvement. And then we did relearning activities based on those. So now I'm going to talk about the clinical portion of this class. So in the lecture, the didactic portion, I went to lecture 2 nights a week. And then for clinical, I went 1 day a week. On the weekend, it was a Sunday. It was an 8-hour clinical. However, this clinical was about 2 hours away from my house. So it felt like a 12-hour clinical because it took me 4 hours round trip to get there and back. And then it took me 8 hours where I had to be in the hospital. So it was 12 hours out of my day. It was exhausting. But I did have a really positive clinical experience. I'm not going to take too much time talking about clinical because it was on a med-surg unit, which I've done clinical before, and it was a very small, older hospital. So I didn't really see or do anything at this clinical site that I have not done in previous clinical sites, except one major thing. I was a part of a code, and I am not going to get too much into detail about it. I might make a separate video about that too, where I am very respectful of the patient and I don't give out any personal patient information. But I was a part of a code and I did compressions, which I'm qualified to do because I have CPR training and I have my BLS card. But that was something that I got to do in this clinical, and I've never done that before. And it was really exciting, and overall it was a really good experience, and I'm happy that I had the opportunity to do it. And then other than that, I really liked my clinical instructor. She's a nurse practitioner. She's been in the field for decades, and she was just really, really knowledgeable. Her specialty is cardiac care. And so she actually would take the time and teach us, like she would sit in the break room on our breaks and she would teach us different things about the cardiac system and about our patients. She would print out EKG strips and she would show us telemonitors, and she would actually teach us and quiz us on the different cardiac rhythms and different issues going on with the heart. She was also really good with pharmacology, and she created these like drug sheets for us. And so any time that we went to clinical and we had to administer medication, of course, she would have us complete these drug worksheets. She always brought in this thick drug guidebook, and we would have to do our own research and fill out these worksheets, and then she would go over them with us. So later in the day, by the time that we were actually administering medication with her, we knew exactly what the patient was getting. We knew what it was for. We knew the brand name, the generic name. We knew the contraindications. We knew when the medication would take into effect, how long it would be effective for. So this was really the first clinical where every single medication that I administered, I was able to genuinely educate my patient on why they were taking it and what they needed it for. So I really appreciated my clinical instructor. She taught us, she challenged us. And so overall, I felt like I got a lot out of this clinical because of my professor. And then other than that, I mean, Yeah, it was a small old hospital. It was in Virginia. I think technically it was still Northern Virginia, but it didn't feel like it. It was just kind of really out there. I mean, the staff was nice. It was a clean hospital. It was nice. It's just, I think I'm used to being in like the DC metropolitan area, the Northern Virginia, and so we have really good, bigger, high-tech hospitals. And so I think I've been really lucky where I've gotten to do and see a lot. And so going to a hospital that was smaller and older, to me, the patients were not as critical or complex as patients that I've cared for in the past. So my clinical instructor really made this clinical, she's really the reason why I got so much out of this clinical. Other than that, I got to practice, my bedside manners, charting. That was another thing about this clinical. This was a brand new software to me. It was an older software. It's called Meditech. I had never even heard of it. I really don't ever want to work for a hospital that uses Meditech. I prefer Epic. I think all of the hospitals in my area use Epic, and I think a couple use Cerner. But yeah, Meditech was older. It was not very user friendly. It wasn't very user intuitive. And to me, it felt like there was a lot of room for errors. Epic is a newer software. I don't know if Epic is newer or if they just constantly do updates, but from my experience, anytime that I've used Epic and charted in Epic, they have a lot of safeguards to help you not make mistakes. They really try to eliminate human error with Epic, which I really appreciate. And none of those safeguards seem to be in place for Meditech. If anything, it seemed like it was easier to make a mistake with that software, in my opinion. Maybe just because I'm not as used to it. So that was really frustrating, but I feel like it was good for me to learn how to use a different electronic medical record software. So now looking ahead to next session, right now, I'm on winter break, which I'm really excited about. Haven't had a break since I think May, which has been a lot. I've been feeling like I've been losing my mind and really stressed. And so it's nice to we have like a 2-week break before we start up classes again. I work full time, so it's not a full break. I'm still working 40 hours a week, but I'm really looking forward to just working and getting off and coming home and not having homework, not having clinical to go to, and just spending time with my husband and my family. And so next session, I will be taking collaborative health. And to be honest, I'm not really sure what that class entails. So I will let you guys know what the class is when I get there, when I'm done with the class. But I'm really excited because I landed a clinical in the ICU and my clinical's in Maryland. So the last 2 sessions, I've had to travel over an hour and a half one way just to get to my clinical. So this time, or in January, I'm gonna have a clinical in Maryland that's less than half an hour away from my house. So I'm excited about that alone. And then I believe my clinical instructor is an instructor I've had in the past who I really adore. And I will be in the ICU again. Anytime that I see the ICU as an option for a clinical site, I always take it. I don't care where it is or how far it is. I just got lucky that this one's in Maryland. And so I think that this will be my 4th or 5th. I think this will be my 5th ICU or 5th ICU that I have done clinical in. And so I think I've told you guys in a previous video, I thought that all nursing students got ICU experience when they were in nursing school. And recently I learned that that's not the case. Most nursing students don't get to have any experiences in the ICU. So I'm very fortunate that I have had multiple clinicals in the ICU and I've gotten to work in ICUs now. It will be now at 5 different hospitals. So I'm very excited. I think critical care is definitely something that I'm very passionate about. I'm still trying to decide what specialty I want to go into. I don't want to say it on the camera because I don't want to jinx it, but I'm pretty sure I've decided what specialty I'm going to apply to. Whether or not I get into that specialty, I don't know, but I've decided what specialty I'm going to shoot for, and I'm going to start applying to jobs really soon, which I'm also really excited about. So overall, I feel like I have a lot to be excited about in the new year and next session, and I'm just really happy to keep going. I'm very happy that I finally made it to my final 2 classes. So I will keep you guys posted on what collaborative health is, how my clinical experience is, and what you guys can expect when you get to that class. So that is it for this video. Thank you guys so much for watching and supporting me. If you like this video, please go ahead and give it a thumbs up and subscribe to my channel. Happy holidays, and I will see you guys in the next video.